And the clapping is for the one and only, I love her dearly, Dr. Wanda Dyson is joining us. Now, she's not only a medical doctor, but one thing that I loved about her when I met her a couple of years ago was that she's a medically trained doctor, Stu, but also she believes in alternative medicine. And she is here to join us to basically kind of help us to talk about the coronavirus. She's put together a survival guide. She's also done her research when it comes to African Americans. And then at the end, she's got this fabulous book out that she's going to talk about. So, Dr. Dyson, thank you so much for being here.
It's a pleasure. Thank you for having me. Did
you like my clapping, my intro that I did for you?
Loved it.
So listen. Let's go ahead and get to the nitty and gritty, because I know you're a busy woman and you have things that you need to do. So let's talk about the survival guide. So why did you write that in the first place?
Well, because it's easier to blow out a match than to extinguish a raging wildfire. Meaning that I want to be on team prevention, helping those that are not sick stay well, instead of on team disaster management, as many of my colleagues are, that are on the front lines battling coronavirus. So I'd like to help those that either don't have the virus at all, have the virus but no symptoms, and I think that's around 46 to 50% of people. They're asymptomatic carriers. And there was this may date me, but there was a public service announcement that was out when we were young, and it was Smokey the Bear who said, only you can prevent forest fires. Later he changed that to wildfires. But there are tips in my coronavirus survival guide. 1 is be calm, don't panic. 2 is sleep. And 3 is focus on staying well. And in the guide, I explain why these 3 areas are important and how to achieve them.
You know, I was thinking, because, of course, we'll get to your book later, but I was reading your book, and a lot about what Dr. Dyson talks about in her book is the importance of sleep. And I just think overall, you know, to talk about just taking care of yourself and just trying to be healthy, that in itself can actually help you fight against the coronavirus. Not many people think that way and do that. Would you say?
I would agree. We feel that sleep, a lot of people feel that sleep is overrated, but it's actually underrated, because when we sleep is when we actually turn on our immune system, and that protects us against viruses, bacteria, and cancer.
And in terms of those guidelines, so, you know, we've got Stu, who's sitting in the studio right now in Foxton Beach in New Zealand. We'll have people listening from Australia and all over America. Anybody can use this survival guide. It doesn't matter where you are and your location, correct?
Correct.
Yeah. I also wanted to go on and ask you about the CDC, because you're a physician and also you practice alternative medicines. Are you in step with the CDC in what they're recommending for Americans when it comes to the guidelines for the coronavirus?
Well, as far as preventing the spread of COVID-19, yes, but I think there's much more that we can do beyond those guidelines, which are just external protection mainly. We need to strengthen our immune systems, and that's why I wrote the survival guide, the things that we can do that would make that happen.
And I also want to ask you about your colleagues, because Stu earlier was talking about nurses there in New Zealand that are on the front line that are, you know, getting this virus and greatly being affected by it. What are your colleagues saying to you in Washington and around America as to what they're facing right now?
Well, from what I can observe in talking to them, and also online relating to other physicians and what they're saying from the front lines, many of them are afraid. They're overwhelmed. I've heard one nurse said that she feels like she's in a death trap. They are traumatized themselves, and some of them feel like they don't know if they can go on, and that they may need mental health interventions after all this is over if they can survive it.
I can understand that.
And it's got to be heartbreaking for you to see your, you know, colleagues in that position, and in some of these hospitals we know Stu, you would have seen it overseas. Some of them don't have the basic protection. They don't have the mask. They don't have the gloves. They don't have the basic things that they actually need. And then, you have people say, wait a minute, this is the United States of America. What do you mean you don't have that? So I think this has been an eye-opener for many Americans in terms of the cracks, Dr. Dyson, in our healthcare system. And that brings me to you when you talk about alternative medicines. I mean, there are different things that we can do to stay healthy besides popping a pill.
Exactly. And the first thing is to be calm. Don't panic. That sounds like it's easy to do, but a lot of people are really freaking out. But what we need to do is remain calm, because fear itself can kill you. There was a cardiologist back in 1967 that was called to Cape Canaveral because the young aerospace technicians and engineers were dropping dead from sudden cardiac death, and they thought it was the impact of the work week, 70-hour work weeks, and the stress of launching the rockets, but it was actually that they were afraid of being fired, because 15% of them would be fired after a launch. They've also seen that people who are anxious and depressed or have PTSD have an overactivity in the part of the brain called the amygdala. They call it the fear center. And that alone can increase your risk of having a heart attack, a stroke, or heart failure. They've seen people with overactivity in that area have those types of outcomes. So we don't want to die out of fear of getting coronavirus or fear of what can happen. We need to calm down, and there are ways that we can do so.
Yes.
I talk about those in the guide.
Yes, very much so. I want to play a clip because one of the most affected communities right now would be the African American community. So, Dr. Dyson and Stu, just hang on there. This is a clip from Dr. Fauci from the CDC.
We have a particularly difficult problem of an exacerbation of a health disparity. We've known literally forever that diseases like diabetes, hypertension, obesity, and asthma are disproportionately afflicting the minority populations, particularly the African Americans. Unfortunately, when you look at the predisposing conditions that lead to a bad outcome with coronavirus, the things that get people into ICUs that require intubation and often lead to death, they are just those very comorbidities that are unfortunately disproportionately prevalent in the African American population. So we're very concerned about that. It's very sad. It's nothing we can do about it right now except to try and give them the best possible care to avoid those complications. Thank you.
Thank you very much. And
Victoria back from here with At Home with Victoria. I'm joining this conversation today with Dr. Wanda Dyson and also Stu Frith from New Zealand. And that was a clip from Dr. Fauci with the CDC, and he's also on the President's Task Force for the coronavirus. Dr. Dyson, it is absolutely devastating every single day to turn on the television and you look at major cities like Chicago, Washington, D.C., Milwaukee, all of these major cities, and at the top of the list, black folks are dying. Very difficult.
Yes, it is. So in my research, because you gave me the charge of finding out why this is happening. And I was talking to my certified nutritionist, her name is Meg Lamke, about this. I just mentioned, African-American males are dying at higher numbers than even African-American females, and African-Americans, period, are dying at higher rates. And she said, African-Americans have this deficiency called G6PD deficiency, and 1 in 10 African-American males have it. And I remembered it, from, back in the day in med school, but then I began to really dig into this. And basically what it is they have a tendency, if they face a trigger being a virus or a medication, that they can actually destroy their red blood cells, and it can lead to kidney damage. So coronavirus itself is one of those triggers. And also the medication that Trump is touting, hydroxychloroquine, is one of the medications that is a trigger for people with G6PD deficiency that can cause them to rupture their red blood cells. And I had not thought about this before. I actually found an article in the Journal of Infectious Diseases from 2008 on how viruses such as coronavirus, and it wasn't COVID-19, it was 229E, how the stress from that viral infection could cause down of red blood cells in African and American men.
Well, you know what? It sounds
like
we need you on that task force.
We're overlooking something that's important. Excuse me for talking over you.
No, that's okay. It's all good. I was saying that it sounds like we certainly need you on that task force. But getting back to what you said, that we're overlooking something that is very important. Obviously, what you're saying is right. I'm no physician. I know nothing about it, but I know well enough to know that you do your research and do due diligence as well. In saying that, I wanted to mention my cousin Nikki, Dr. Dyson, and Stu, you know this, who died. It was about 4 days ago, and she died from the coronavirus, and it happened fast and sudden. She was tested because someone else in her office had it, and she was told to go home to work from home, and she did. That was, I think, on maybe like a Wednesday. On a Friday, she got sick, and then, she was rushed to the emergency room, and, from what I'm told, her kidneys actually started to fail, and she just didn't have a chance. And you're talking about somebody who was a 45-year-old black woman who was healthy, worked out, did every single thing that she was supposed to do, and she's now gone and left behind 3 kids. So needless to say, my family is quite devastated over this. So, Doctor, it seems like it's getting to the point within the black community that everybody is going to know somebody or know of somebody who's died from this.
Definitely, and it is very sad. And that's why I want to be on the end of prevention, because we don't want to get to the point, A, that we're sick, but if we are, we need to do some things, and we're kind of like on our own with this. As you can see, they sent her home. Mm-hmm. A lot of people have symptoms that aren't even getting to see a physician, and it's not just people who are impoverished that this is happening to. It's happening to people who are more affluent. I have a friend that basically she had fatigue and weight loss of 10 pounds in less than a week. But when she called her primary care physician because she didn't have a fever, they refused to test her for coronavirus and told her to stay home. Well, this can also escalate into a more serious problem. It can go from mild to severe very quickly, as it did in your cousin.
Yeah, and in terms of testing, are we still at the point basically where we were last week and a couple of weeks ago? We're not doing nearly enough testing in America as we should.
Pretty much, and looking at the numbers that I see from Johns Hopkins site on coronavirus, I think those numbers are probably 3 to 10 times what we're seeing there. Yeah. For those of you that are joining us, you're listening to At Home with Victoria via International Connection Media. I'm Victoria, broadcaster and also a photojournalist, and have the pleasure of having a conversation about the coronavirus with Dr. Wanda Dyson, and also in studio at Foxton Beach in New Zealand is Stu Frith, who's been basically giving us an update on things that's happening overseas. And Dr. Dyson, New Zealand is one of the countries that's actually beating it, and they're doing a very, very good job of it in terms of population size and the measures that Prime Minister Jacinda Ardern put into place there in the country. But, Stu, you actually had your health prime minister who didn't take his own advice, and he was caught out and about and decided to resign, but his resignation wasn't accepted by the prime minister. That must have caused a stir there in the country.
To be really honest, I was hoping you weren't going to mention that, because it's a total embarrassment when it comes from somebody in that category. But yes, he went out on a bike ride and broke and flouted all the laws, So goodness gracious me, the ones that the top can't get it right, how they expect the rest of the country to carry on? It's just unbelievable, isn't it?
Yeah, no, that is true. Yeah, no, that is certainly true. So, Dr. Dyson, let's talk about your book. I have it in my hand, How to Be Healthy. It's Not What You Think, Sleep, and also inside the book you include some sleep solutions. So one thing I can tell you after reading the book, the chapter that was very important to me, and that was sleep and cognitive ability, that it's very important that you get sleep because that's when your brain at night sort of regenerates itself. So that chapter, which was chapter 7, very much spoke to me. So why is it that you ended up really becoming an expert on sleep?
Well, it was sort of by chance. I was invited to speak at a conference, the Think Well, Be Well conference. It was Candace Camille who had the bright idea of doing this, and she wanted to have different doctors, Dr. Hydration, Dr. Nutrition, Dr. Exercise, Dr. Mental, and she wanted Dr. Sleep, and there was not anyone to volunteer for that job. So a friend of mine invited me to do it, and I agreed. I didn't know anything about sleep because it's not a part of our medical curriculum. They actually don't plan for us to sleep. We're going to be deprived of sleep, actually, all throughout our careers. So I took it on to be Dr. Sleep, and I began to do research, and I was shocked at how devastating it is not to sleep. I was able to make a connection between lack of sleep and quite a few of my friends who contracted breast cancer and answered many questions that I had unanswered before.
Well, I tell you, if you are interested in the book, we can order that on Amazon, or can you give us a link to find it for people that want it?
It's on my. It's not on Amazon. It's on my personal website, and it's called How to Be Healthy. It's Not What You Think.com.
And in fact,
they can order it from there.
And what I will do is, when the show is over, in the chat room as well as on our page, I'll go ahead and put the link that you provide for me for people that are interested in actually reading the book. But it's interesting because also in the book, you talk about how lack of sleep increases your risk of death, cancer, brain shrinkage, depression, suicide, hypertension, diabetes, heart attack, overweight, accidents, and infertility. So it's amazing how, sleep is really just that important and vital to our lives, that if we could possibly fix that, perhaps it can fix other things in us.
Yes, and it's very relevant to what's happening now with the coronavirus epidemic, pandemic, and that is we need to sleep between 9 p.m. and 2 a.m. or at least between 10 p.m. and 3 a.m. because that is when the immune system gets turned on. And the immune system has unique cells called natural killer cells. I call them Pac-Man for the body. And what they do, like Pac-Man on the board, is they go around and they chew up the virus-infected cells, the bacteria, and the cancer cells. So that's why we need to sleep in order to boost our immune system during this whole epidemic. But what I'm finding is a lot of people are in such fear, or they're stressed, or they're anxious, and they're not going to sleep, or either they're up looking at television, computers, tablets, or cell phones, which prevents you from being able to fall asleep, because in order to fall asleep, you need melatonin, and the blue light that comes from those devices blocks melatonin, and you're not able to fall asleep as you need to. So it's very important that we sleep between those hours, and we need at least 8 hours of sleep, as you mentioned before, for cognitive function, in order for our brains to function. Because for every hour we don't sleep, the brain shrinks considerably. And this starts when we're young. We think of it as something that happens to older people, but it begins like in our 30s.
That's interesting. Stu, you had problems sleeping. Has your sleeping gotten better?
My sleeping is really good now, really fantastic, and I'm quite surprised actually, because I've always been a poor sleeper, but now it is absolutely excellent. Like, I've been up now for a couple of hours. I'll tell you what, if I got in my chair, I could get back to sleep again, no trouble at all.
Now you should tell everybody what day and time it is there also, because you're on a whole different time zone. It's morning there in New Zealand, isn't it?
It is morning here. It's just about 10 a.m. and it is a Thursday. So it's Wednesday where you are, isn't it? And
yes,
so it's Thursday. And New Zealand, of course, leads the time zone. So I always say, Doctor, if you want to taste the future, come and have a visit to New Zealand.
So, Stu, what do you attribute your ability to sleep now to? What has changed?
I don't know. Just got to get rid of a lot of worry, I think. A lot of stuff sort of in the back of your mind. You don't realise you're doing it, but you do have it, and every little thing sort of mounts up. And now I've got clear of all that stuff, and no trouble to sleep. It's good.
Excellent. I also want to
that
say
would be that stress. So, Doctor, that would have, in his case, that would have been that stress and worry that was preventing him from sleeping. Yeah.
Yeah. So maybe this whole lockdown is good for Stu.
Yeah.
Yeah.
What was your next
I certainly
point?
enjoy sleeping.
Doc, what was your next point you were about to make?
I kind of lost it.
Oh, that's okay. Well, I'll pick up and say a few things. I was thinking when you were talking about the blue light that comes from the tablets and all of that. I noticed with myself is that because I'm in the news business and I'm a news junkie, I just don't watch the news anymore. So, I rarely will have the television on in the house. In the morning, I get up, I look at, the main stories, and then I just have to put it away because it greatly affects me. It affects my mood. If I wake up and I'm in a great mood and then I turn on the news and I see something, like most people, you rant and you rave and you talk back to the television and you're upset. So what I've had to do just the last, I would say, week or so during this coronavirus is literally just to shut it off. And that doesn't mean that I don't care about it. It doesn't mean that, I'm not paying attention to it, but I have to shut it off. I go outside. I put my beats on. I go for a walk. I go for a run. I take pictures of pretty flowers. I do things, to kind of de-stress me. And I think other people should think about that too. But my problem was I thought that if I wasn't watching it all the time, then I wasn't caring about it. But I realized that's absurd. Of course I care about it. I care so much. I just need to stay away from it.
Well, that's exactly what I advise in my book, that we minimize our exposure to negative news, to minimize fear, anxiety, and depression. And I advise that they do some of the things that you're doing. For some reason, was the point I was going to make. For some reason, people feel that staying at home means they need to be locked inside the doors and not go outside and not be exposed to sunlight. And what we actually need is sunlight during the day, especially the first half of the day, because that primes our bodies to produce melatonin at night, which helps us to sleep. So we can go outside just as long as we obey, the social distancing guidelines and get some sun. If you can't go for a walk, you can at least go into your backyard, your porch, balcony, or whatever, but we don't need to be locked inside all day.
Yeah, that's good advice. Well, listen, we have run out of time. And I'm so grateful that you came here to spend this time with us and that the world got a chance to listen to what it is that you had to say. And I have no doubt that you will be back again because your knowledge and what you have to talk about is always so valuable. Was there any last minute thing that you wanted to say before we say goodbye to you, Dr. Dyson?
I'd like to say stay safe and be well and focus on keeping your immune system strengthened. And I have those advice for how to do that in the book.
And we're going to make sure that we put all of your information out there about the book. Listen, thank you so